Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, December 6th, 2023. Thank you so much for joining us. As always, it's your chance to get your COVID questions answered, your flu questions answered, your other infectious disease or public health questions answered. You'll be able to put your questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. You can see we have two guests with us today. These are both esteemed members of the Chicago Department of Public Health. Thank you for being here. This is Dr. Michelle Funk. She's our medical director for youth settings, so has been super involved with all things related to daycares and schools and other places where young people gather. And then this is Stephanie Gretsch. She's our senior epidemiologist. She oversees all of our vaccine preventable diseases and surveillance work. So everything, all the data that you've been seeing for the last few years about vaccines, whether that's COVID, whether that's flu, Stephanie and her team do that. So I want to let both of you just introduce yourselves a little bit. If you can tell folks, I gave them a little bit of what you do, but just so they have a sense of what you're doing. And they're both here to talk a little bit more about the background of how we actually do this respiratory virus surveillance. Surveillance is the public health term for tracking a disease. And it's also, as you will see, Influenza Vaccination Awareness Week. So it was an important week to talk about it. So Michelle, do you want to start? Just give a little bit of your background and what you do at the health department?
Yes, Dr. Arwady, thank you so much for having me here today. Within the Youth Settings Group, we help to support schools and early child care centers as well as universities with their mitigation strategies for COVID and other communicable diseases, so diseases that can be spread from person to person. We do help to relate communications as well as to oversee outbreaks, as well as to help even with guidance, and I'm really happy to be here today. Thank you.
Yeah, my name is Stephanie Gretsch. I'm an epidemiologist in our Vaccine Preventable Diseases program, and so we have a team of epidemiologists and other staff that are sort of in charge of surveillance, so tracking vaccine preventable diseases like measles, mumps, chickenpox, whooping cough, but we also coordinate surveillance for flu in the city of Chicago. And more broadly, we look at other respiratory viruses like RSV or rhinoenterovirus that cause respiratory illness among Chicagoans. Our team is also responsible for looking at immunization coverage data. So we look at and estimate the proportion of Chicagoans that have received their flu vaccine or got their COVID vaccination as well.
All right, great. So if you have questions about data, about how we think about vaccinations and flu and outbreaks in school settings, these are going to be your experts to ask. As always, we will go to some of our dashboards and then we'll go through a presentation. I'm going to have both of them actually do some presentation of data, which we'll spend a fair bit of time on because there's a lot of detail. And then near the end, about the last third, we'll have the opportunity to take your questions directly. So let's go ahead and turn first to our COVID dashboard, chi.gov/COVID-. As you can see, we are at a medium COVID level, and we'll talk about that. And if we look at the numbers here, our cases are up. We're averaging about 550 lab confirmed cases every day here in Chicago. That's up from about 369 last week. Some of that is that post-Thanksgiving, a little bit of a surge, not unexpected. And again, this is just cases that are lab confirmed. So it doesn't include the hundreds of people who are having positive COVID tests in a home-based test every day. Hospitalizations, though, as you see, have actually remained relatively flat, which is good. That's what we want to see. Even if we're seeing COVID cases, if people are up to date with their vaccines, if they're taking the medications that help keep them out of the hospital, we really don't want to see a big surge in hospitalizations. Deaths also have really been quite low. Vaccinations are up a little bit compared to last week, but we're doing about 3,300 a day, and you'll hear some more detail of that. When the booster first rolled out, we were doing about 6,000 a day. So we're down from where we were, but still more than 3,300 Chicagoans on average every day getting their COVID booster. So that's good. Our emergency department visits are still relatively low, up just a touch, and our hospital beds occupied by COVID patients are also up just a bit. We went from 3.3% last week to about 4% of our hospital beds being taken up with COVID patients. So all of this suggestive of some increase in COVID, not a major surge at this point, and again, not unexpected post some of that holiday gathering. I also want to show you, just because we have some of the influenza experts here, if you go to chi.gov/flu, I'll just show you how that works. If you go to chi.gov/flu, and you'll come and you'll get a whole page here about everything that's happening with flu. So lots and lots and lots of information, flu myths, flu vaccine, how you find flu medications, how you find a flu shot, what's the difference between flu and COVID. Feel free to check that out here. But right up at the top, there's this flu activity tab. And if you go to current weekly report, you can see updated just as of the 6th, as of today. Looking at the most recent data, influenza activity continues to increase. We had 28 flu-associated ICU hospitalizations this week, meaning 28 Chicagoans are not just in the hospital, but in the ICU with flu. You can see what percentage of our tests were positive, et cetera. So this is really all of the data here for Chicago, specifically, and this is Stephanie's team that pulls all of this together. And you can look at graphs of what's happening with ICU hospitalizations, what's happening with lab surveillance, outpatient labs, influenza-like illness activity. So we're going to show you some of this, and Stephanie's going to talk through it in some detail. But this is where you can come every single week and see what's happening. And if you go to archive weekly reports, you'll actually see all of the historic data going all the way back to 2010. You can click on a given week and see what was happening. So we really encourage you, if you're interested in the data that we are showing today, to explore these. And if you are taking a look while we're talking and you have questions, again, now is a great time to ask them. So I'm going to go ahead and turn to just our slide presentation here. Okay, so first of all, just quickly from a COVID perspective, we are at a medium level. And just to remind you what that means, the CDC determines that on a county by county level every week, and the updates usually come late Thursday evening. And so they're looking at new lab diagnosed cases per population in the last week. Our goal is to be under 200. You can see both the city of Chicago and broadly Cook County remain well under that goal. They're looking at new hospitalizations per 100,000 population. Again, in the last 7 days, the goal is to be less than 10. You can see that Cook County, and that the way the CDC does hospitalizations, it includes the whole region. So it's not just Cook County. It's actually if any part of this region has a significant surge in hospitalizations. If that gets over 10, that's one of the things that kicks us from low into medium. So it is that number that is right now having us be at a medium level. And then similarly, the percent of our inpatient beds taken up by COVID patients, we want to keep that at less than 10%. You can see that both Chicago and Cook are well under that. So we're in medium, but kind of on the lower end of medium. And just as a reminder that at medium risk, the most important thing is to stay up to date with your COVID-19 vaccine. That means getting your fall 2022 booster if you have not. You should really wear a face mask in indoor public settings where vaccine status is not known. I continue to always put a mask on if I'm on the L, if I'm in a public indoor setting. I think, not just COVID, but flu and other viruses are on the increase. It's a good thing to do to help limit spread. You want to keep getting tested if you have symptoms. You have to continue to follow all isolation and quarantine guidance if you're either infected or exposed, including wearing a mask. And then, of course, if you're at higher risk, please do talk to your healthcare provider. If we look at our additional COVID indicators, our emergency department encounters are still at a low concern level. Our wastewater sampling is actually at a high concern, and that is consistent with what we're seeing across the country. Often we will see higher levels in wastewater preceding a little bit of an increase in cases. And so these just come low, medium, or high, and so we've technically hit the threshold for that higher level of concern. And our variant risk assessment is at a medium level of concern. This is what the national map looks like. So last week, just under 6% of U.S. counties were orange, which means high COVID community level, and about 25% were medium, like Chicago and Cook in yellow there. So you could see there's not any major surge happening in a huge swath of the U.S. There continue to be some pockets, certainly, of increase. Just a reminder that at this point, it tends to be hospitalizations that push counties into a medium and a high level as much as those case numbers do. And so in downstate Illinois, we do have some counties that are at a high level at this point. And especially important if you're going there or really anywhere that's a high level, you really should be masking indoors in those settings and taking extra precautions. Make sure you're up to date with your vaccines before you travel to a higher level county. If we look at variants here in the Midwest, we have continued week after week to see evolution of more infectious Omicron subvariants. But the good news is it's all still Omicron. And you hear me say this every week. My biggest worry is that one of these subvariants, every color on this graph here, represents a different subvariant of Omicron. And you can see, whereas on the left there, that was early September, almost all of our cases were that light turquoise. That's BA.5. That's a subversion of Omicron. If you go to the most recent week, ending December 3rd, we're down to less than 20% of our cases being that BA.5, and we've been seeing all of these new subvariants emerge. Every time COVID spreads, person to person, it copies itself, and that is when you have the potential for new variants to emerge. And so one of the reasons we're concerned when we see cases going up, it's not an emergency at this point, but not only does it mean more illness in Chicago, it also means more opportunity for variants to emerge and for variants to spread. And so, again, not entirely unexpected to see all these subvariants. And the good news is they are all still Omicron. So getting that updated fall 2022 booster, it's a good match for the variants that we're seeing here. And it's important that you do that. Also just wanted to remind you that if you test positive for COVID, and you're more likely to get very sick, if you're over 50, if you have an underlying condition, et cetera, there are really good treatments available. And I want to encourage you to get those. Please don't delay. The treatment has to be started just within days of when you first develop symptoms to be effective. So for example, Paxlovid is probably the best known. That's an oral pill. It was granted an emergency use authorization for treating mild to moderate COVID, but you have to take it in the first 5 days of when symptoms start. Paxlovid is available for anybody ages 12 and up that weighs at least 40 kilograms or 88 pounds. And the idea is you take this at the beginning when symptoms are still relatively mild to help prevent developing more severe illness. So it's meant for those who have that higher risk of developing severe illness. When older people in my own family have gotten sick with COVID, they of course are up to date with their vaccines, which is the most important thing. But I have also encouraged them, and they have taken Paxlovid, and I would encourage that for you too if anybody in your family gets sick. There can be side effects, there can be interactions with other medications, so you do need to talk to a healthcare provider. If you don't have a healthcare provider, you can visit a test to treat location, and I'll just show you that real quick. If you click on that, there's a national, really this is a national approach, so you can find a test to treat locator. If you just put this in here, you can put in your own address. Let me just show you how this works. So I'll put in the address of the health department, which is 333 South State Street, Chicago. But you would put in your own address. And if I want to look within, let's say 10 miles, this will come up and it shows me there are 35 locations that have a pharmacy that can on the spot do the evaluation and the prescription for that medication. There are 480 places to fill a location for Paxlovid. So depending where you are, you can look this up. There are about 70 locations within Chicago, give or take. So, and then your own doctor is probably the best to be able to prescribe you that medication, but just in case you're not able to find it, for example, it will let you do this. Sorry, I got a little overambitious here. There we go. Okay. All right, so just as a reminder, if you think you're up to date with your COVID vaccines, but you haven't been vaccinated since Labor Day, it's time. You're probably not up to date. previously vaccinated Chicagoans over the age of 5 should get that updated booster. Breaking news that Pfizer and BioNTech have asked the FDA to authorize a booster for children under 5. So we don't have official dates on this yet. It's not officially available. But it's possible, and I think it's even likely, that the COVID boosters, the updated boosters that help protect against Omicron, for the youngest Chicagoans, those aged 6 months to 5, I think there's a good chance we'll get the green light, and they could be administered even before the new year. So that's exciting. And we've got a lot of detail online if you have questions. If we look at our booster coverage for COVID among Chicagoans, we continue to exceed nationwide estimates, but these are much too low everywhere. If we look at the population over the age of 5, you see about 12.7% of the U.S. has had a fall 2022 booster, and about 15.9% of Chicagoans. That is not enough. And if you look at those over 65, that is who is really driving our hospitalizations. This is the group I'm the most worried about. And even here in Chicago, we've only just crossed the 1/3 mark, 33.6%. So 1 in 3 Chicagoans over 65 have had that booster. If you know somebody who is older, has an underlying condition, critical that they get the vaccine, because hospitalizations are also on the rise for COVID. We have administered over 429,000 doses, so that's good. We're getting close to that 500,000 mark. You can see that the average, that red line shows the average that we're administering each week. It has decreased just a bit. We were at 4,500 last week. We always see a pause around a holiday like Thanksgiving, which is why on the dashboard it was showing around 3,300. But we're around 4,300 generally if you leave out Thanksgiving. And in terms of demographics, we continue to see a lot of disparities here. White Chicagoans still have gotten more than half of the updated COVID vaccines. About 19% have gone to Black Chicagoans, about 16% to Latinx Chicagoans. Women more likely to have gotten a vaccine than men here in Chicago and across the country. And if we look not just at all Chicagoans, but at those who we know got their original vaccines. So these are not folks who said, I don't want a vaccine at all. These are people who had their original vaccines. They had 2 Moderna, they had 2 Pfizer, they had a J&J. Of those, still less than 1 in 4 have gotten that updated fall booster, and I am concerned about that. We're at 23%, up 1% from last week. And here too, you see there are disparities, and especially, you know, the youngest people and the oldest people is who we tend to worry about, and the uptake is not where it needs to be. So a reminder that you can get your updated COVID booster and your flu shot at home, as long as at least one person in the group of people getting vaccinated is getting a COVID shot. We'll do flu shots for everybody, up to 10 people. So it's no cost to anybody in Chicago. Everyone age 6 months and up. We have appointments Saturdays, Sundays, Mondays, and Tuesdays, 8 a.m. to 6:30 p.m. So give us a call and we will bring vaccine to you. This Saturday, we will be at Olive Harvey College from 9 a.m. to 2 p.m. with COVID vaccines for all ages, flu vaccines for all ages, 6 months and up. Everything's free. We do take walk-ins if you don't have a chance to register in advance. And as always, if you have any COVID questions, chi.gov/COVIDvax, or give us a call 7 days a week, 312-746-4835, and we will get you sorted. I want to switch gears and talk about influenza and bring in our guest to the conversation. So I've been showing this week after week. This is the national picture of what is happening with influenza-like illness, and we'll talk about that in a second. But the darker colors, the red and the purple, represent very high influenza-like activity. And you can see that most of the country at this point is now red or purple, and Illinois has moved into that higher influenza-like activity level. I just want to show you in comparison. This is for the week ending November 26th. Over the last 6 years, this is what the U.S. looked like. So you can see this is the current week this year. This is what that same week looked like in 2016, 17, 18, 19, 20, and 21. So this is a very early flu season. So far, it's been quite a bad flu season. And influenza hospitalizations nationwide right now are actually higher than they've been in the past decade right now. And it's only the beginning of December. And nationwide, for the first time in the pandemic across the whole country, influenza hospitalizations in yellow there overtook COVID hospitalizations in blue. So that really is a benchmark for us. We're still seeing a lot of people getting hospitalized with COVID. You see that's on the increase too. But flu is very much here this year in a way that it really wasn't the last couple years. So this is National Influenza Vaccination Week, December 5 through 9. I want to thank the Blue Cross Blue Shield building for doing some of the best messaging in town. It is lit up with Get a Flu Shot in the evening. And during this week, this is an annual observance in December to remind everyone aged 6 months and older there is still time to get vaccinated against the flu. It's not too late. It does take about 2 weeks for flu vaccines to fully kick in, so the sooner you do it, the better. But it's especially important for people at higher risk of developing serious flu complications, and that does include young children. Different than COVID, thankfully, young children less likely to get seriously ill from COVID, although it can happen. They are right up there with the oldest Chicagoans in terms of high risk for bad outcomes from flu. And millions of kids do get sick with flu every year. Thousands get hospitalized. So please do help them fight flu so they can do what they do during National Influenza Week. And with that, I'm going to hand it to Stephanie Gretsch, our senior epidemiologist who works on vaccine preventable diseases, to talk you through a little more of that background.
Yeah, so I'm going to talk a little bit about how we track and understand flu activity in the city, and also more broadly, respiratory illnesses that are circulating in the city. So we use these different surveillance indicators to understand what's going on. Unlike COVID-19, flu and RSV are not reportable to the health department. So we don't hear about every case of flu, we don't hear about every case of RSV, but we use these other systems to understand what's going on and circulating. So the kind of first indicator that we look at is outpatient visits. So these are people that are just going to their doctor's office because they feel sick. And here we're measuring the percent of outpatient visits due to influenza-like illness. And we'll talk more about what do we mean when we say influenza-like illness. And in Chicago, we have one federally qualified health center that has multiple locations throughout the city that's reporting this information to us. And we use this as sort of a proxy to understand what's going on in the outpatient setting. We also look at emergency department visits. And here we're looking at the percent of emergency department visits due to, again, this influenza-like illness, or we can also look at other specific diagnoses like RSV or like COVID-19. And here, all acute care hospitals in the state of Illinois report near real-time data to the state, and we can use that information to look at Chicago hospitals. And then finally, we do get some laboratory information, and we're looking at results of laboratory tests for respiratory viruses. Here we're looking at the number and percent of specimens that are positive for influenza or a whole suite of other respiratory viruses. And we have 5 large hospital laboratories and 2 commercial laboratories serving Chicago hospitals and other outpatient settings that submit aggregate weekly testing data to us that we monitor. So we talk about influenza-like illness a lot when we talk about our flu surveillance and flu surveillance for respiratory illnesses, but what do we mean when we say influenza-like illness or ILI? And what this means is someone that's presenting with fever and they either have a cough or they have a sore throat. So we call this a syndromic surveillance approach, and we use this to monitor different healthcare visits for respiratory illnesses, and this is based on symptoms, not on a laboratory confirmed illness. And because we're looking at these broad symptoms, ILI will capture respiratory illnesses due to diseases that present with similar kinds of symptoms. So this includes flu, COVID-19, and RSV. So we really now, in this kind of post-COVID world, we think about ILI as being a good general indicator of respiratory illness circulating in the community. So one way that we look at ILI is through this outpatient surveillance that we do. This allows us to assess trends in outpatient visits due to respiratory illnesses. We look across the season to see kind of where we're at this year, and then we can also compare this year to where we've been in years prior. So the chart on the left, this is showing you information for our Chicago outpatient facilities. This 2% is kind of our threshold. Generally, that's what we see kind of in off-season times. So when we're above 2%, we know we're kind of in a higher, higher period of respiratory illnesses circulating. And what you can see is, we kind of look at the past 4 years as a good comparison, and we're seeing more outpatient visits due to ILI this year than we've seen at any other point.
That's that red bar on the left,
That
right?
red bar on the left, exactly. So just as Dr. already mentioned, we really are seeing an early flu season, and we see that in our outpatient data. And then the chart on the right, this is showing you the same information. So again, looking at percent of visits due to ILI, but this is for the entire country. And that black line with the red triangles, that's this year. And again, in the U.S., we're seeing, a very early season and much higher than typically we see this year, and almost reaching peak levels in years prior. So another way that we use ILI is to look at what's happening geographically. And so Dr. Arwady has showed this national map often. So here, this is looking at, again, this is based on our outpatient visits for ILI. In Chicago, we don't have as good as coverage in every zip code. So instead, when we try to assess kind of geographically what's going on, we look at emergency department visits due to ILI. And you can see the Chicago map by zip code, and there's a lot of red at our kind of highest ILI activity level, basically throughout the city, but particularly in the kind of southern and northwestern parts of the city.
So those areas where there are red, that means there's a lot of people coming to the emergency department with a fever and a cough or a sore throat.
Yes, and we base all of the ILI activity level on what does this look like in non-kind of peak seasons times, and then we compare that to what's going on right now. So when we say we're at the highest level, that means we're the furthest away or the highest activity compared to our baseline. So we also look at ILI in the emergency department setting. So these charts are kind of looking at how we look at emergency department visits. And we look at just generally looking at ILI, so generally what's happening with respiratory illnesses when people come to the emergency department. So that's on the far left. And then we can also use this emergency department data and look, not only at influenza-like illness, but we can look at other kind of diagnoses that happen in the emergency department. So this middle chart, here we're looking at COVID-like illness, which is similar to influenza-like illness, but a little bit different. Here we're looking at people that present with cough, shortness of breath, or difficulty breathing, and they either have a diagnosis, or they might have a diagnosis of COVID, and here we exclude influenza. So this is a little bit more COVID-specific metric to understand what might be going on with COVID in our emergency departments. Right now, we really have seen kind of a plateau of COVID-like illness in the ED, and lower, than we've seen during previous peaks, which again tracks with what we're seeing with all of our other data that we're tracking for COVID-19. And then another example of how we can use this ED data is looking at, RSV, ED visits that are due to RSV. And here, we're tracking specifically children under 5 because they're most impacted by RSV. And you can see, again, this red line is this year, and we saw a huge peak in emergency department visits that were due to RSV. And fortunately, we've started to see declines in kind of RSV activity. But that's just one example of how we can use this emergency department data to broadly look at respiratory illness, but also look at more specific diagnoses. And then we've also used this emergency department visit to assess trends in hospital admissions that happen through the emergency department. So this emergency department data, we can understand if that person actually was admitted into the hospital.
Meaning staying overnight.
Mean they had to stay overnight, exactly. And this just gives us a better sense of, again, like severity of illness. So this person not only presented to the emergency department, but they were sick enough that they had to be admitted and spend the night in the hospital. And here, again, this is just an example of how we use this data, but we've been very closely monitoring respiratory illnesses in children, especially this kind of summer and fall, as we've seen a lot of kids develop respiratory illnesses. So here we're looking at hospital admissions amongst children at our Chicago hospitals, and we're looking at kind of a variety of different syndromes or diagnoses. So the light blue line on the very top, this is looking at just broad acute respiratory illnesses. So this is kind of a catch-all that captures, illnesses due to influenza, COVID-19, RSV, but also just generally pneumonia or cough. And then we can look at specific diagnoses like, again, COVID-19. Here we're looking at COVID-19 in black, influenza in this kind of light blue purpley color, and RSV in the red color. And I think kind of notably, this past week is the first time that we've seen kind of more children be admitted for influenza than for RSV. So again, RSV is kind of coming down while we're seeing influenza starting to surge up. So the kind of last broad category of data that we're looking at is laboratory-based surveillance data. So we're looking at testing data. And here we're assessing trends in test positivity that give us a kind of a sense of what's circulating. So we're looking at kind of a suite of respiratory illnesses, not just influenza, COVID-19 or SARS-CoV-2 here on the chart, RSV, but we also look at other respiratory viruses like rhinovirus, enterovirus, parainfluenza, seasonal coronaviruses that kind of existed before COVID-19, and we also look at data on adenoviruses, although not presented here. And again, we're looking at how are we doing this season in terms of kind of positivity and where we're at, how we're trending. You can see our influenza positivity is shooting straight up. We're seeing
It's that red line again on the left.
Yep, that red line, that's this year. And then you can see kind of right in the middle, COVID-19, kind of even. We're just kind of seeing like steady illness. RSV, we're finally seeing drops in positivity. So it looks like, again, RSV activity is declining. With rhinovirus, enterovirus, again, we're seeing some declining trends there. And everything else is kind of staying stable. And again, so we can use this data to track how are we doing this year, how are we trending, and we can also compare to prior years to see, how does this compare to what we saw last year or 2 years ago. So that's one way we can look at this information. This is this same information, but just presented a little bit differently, and I think is a nice way to think about how we're monitoring these co-circulating viruses. So here, we're still looking at test positivity, but instead of looking year over year for each disease, now we're kind of stretching the chart out. We're looking at a 4-year time period, and each colored line is a different respiratory illness. So this light blue line, this is RSV. The red line is influenza, and the black line is SARS-CoV-2 or COVID-19. And I think you can kind of see where we're at right now, where we've just seen this dramatic increase in influenza positivity in the past few weeks. Our RSV positivity is kind of decreasing. COVID is staying stable. But I think it's also really interesting to look at what we've seen historically, and really back sort of in our 2019-2020 season, you can see that we actually were having a pretty bad year for flu, leading up into kind of January, February of 2020. And when COVID-19 kind of came on the scene and hit, dramatic increase in positivity, activity for COVID-19, and our influenza activity just dropped almost to nothing. And really we didn't see any influenza activity up until last fall, where we finally started to see a little bit of activity, although it peers have been quickly stifled out when we saw this big Omicron surge, that big black peak in 2021, 2022. And then we saw this kind of late season increase in influenza activity last spring. People might remember that we saw a really late year for influenza activity, kind of trailing into late May and June. And now, again, we're kind of back to where we're at, and things are still a little bit shifted and kind of acting a little bit differently than we've seen in the past. We've seen an early RSV season, an early flu season, and we just continue to monitor what's happening so we can better understand how these viruses are circulating and how best to protect Chicagoans. The final way I wanted to talk about how we can use some of our laboratory-based surveillance is we can look at sort of additional details around what types of viruses are circulating. So here I pulled information specifically about influenza. So you can see how we look at the type and subtype of influenza that's being detected this year. There's two main types of influenza, influenza A and influenza B, and then different subtypes within that. So we're kind of some of our laboratory data, we get additional details about the type and the subtype that we see in Chicago. So far this season, 93% of influenza viruses that have been typed or subtyped are this H3N2. So we can kind of better understand what's circulating and how that matches to the flu vaccine. We generally sort of know that H3N2 typically means we're in for a more severe season than if we would see H1N1. So these all kind of give us information about what's happening. So next, I'm going to pass it off to Michelle, and I think she's going to talk a little bit more about our flu vaccine, how flu vaccine looks to be matching this year, and what we've seen so far with flu uptake.
Perfect, and we'll take your questions at the end. So go ahead and put them in while Michelle goes through the last slides.
Go ahead, let's get this,
Michelle. So just kind of tying into what Stephanie just told us about what we're monitoring. This can help us to tie into understanding how well a vaccine might work. So there's a couple of different factors that can contribute to this. One is the person being vaccinated, but really what we're looking at here is what's happening with the virus. So in other words, the influenza virus proteins are changing frequently. Every time there's a new replication of the virus, there can be slight changes, and sometimes those are large and sometimes those are small. And vaccines work best when there's a good match between the flu vaccine and the circulating viruses. So some of the factors that are taken into consideration when we're making a vaccine, one is which flu viruses are currently making people sick prior to the upcoming flu season, because as you can imagine, this vaccine needs to be made well in advance, and so there has to be some prediction of what's going to happen with the following flu season. Also, the extent to which those viruses are spreading prior to the upcoming flu season. Also, how well the previous season's vaccines may protect against those flu viruses. And so the good news is that we have also seen that within the Southern Hemisphere, within 2022, in which most times the influenza season starts around June, there was a very good match this year, and so we expect something similar here. So there are a couple of ways that we can identify what flu coverage looks like, and there's a national level data, and then there's some Illinois-based data, and each of those can tell us a little bit of different information. So for the national data, there's an indication
and
that—
what's flu coverage? What does that mean?
So that's going to actually tell us what vaccination percentage is like within the population. So from the national data, there's an indication that for 2022 to 23, vaccination coverage is similar to what it was this time last year, and the 2020 to 2021 season, but it's significantly lower than it was in 2019 to 2020. And this is for data that was ending up until middle of November. So we're right now around 42.8% coverage. And then again, this is nationally in the children's population, so those who are under 18.
So overall, about 43% of kids under 18 have had their flu shot already this year? Is
Correct.
That what that means?
That's correct. The other data that we have is through a system called iCare. So one of the challenges with using iCare is that it does, unlike the COVID vaccine, it is not required for physicians and healthcare providers to report the flu vaccine administration, but it does give us a little bit more information about potential local vaccine coverage within the Chicagoland area. So nearly 17,000 additional influenza vaccine doses have been administered to Chicagoans. This is overall compared to the number of doses administered to Chicagoans at this time last season. And vaccines have been administered by over 2,600 providers this season in comparison to last season.
And that's just in Chicago?
This is within Chicago.
All right, so that means there's more than 2,600 places in Chicago that people have gotten their flu vaccine.
Correct.
And that could be pharmacies, doctor's offices. That's good.
But then when we're looking at children who are under 18 years of age, we're noticing that we're continuing to see fewer flu shots being administered to children under 18 this season compared to the same time period in the 2021 to 22 season. And nearly 11,000 fewer flu doses have been administered to this age group this season compared to last season. And then even most importantly, as we've talked about, those who are under 5 can really be affected by influenza. We're seeing that approximately 3,000 fewer influenza vaccine doses have been administered to children under 5 years this season in comparison to the same time period last season. And despite starting the season slightly stronger compared to last year, at week 40, the number of doses administered in this season dropped below what it was to 2021 to 2022. And this data is through October. Some additional data will be coming soon to reflect what's happening from November. So I do just want to use this opportunity to remind everyone, as we're thinking about respiratory virus season, there are many of the same ways to protect ourselves and our children against respiratory viruses that we have come to be familiar with through COVID. And so one of them is that when there is a vaccine available, which there is not for RSV, but there is for flu and COVID, we really want to make sure that everyone in the household is vaccinated, and especially those eligible children are vaccinated against flu and COVID-19. So we can do what we can with the tools that we have. And then as also a reminder, making sure that we're practicing appropriate respiratory hygiene, teaching our children to thoroughly wash their hands often, especially after they have coughed or sneezed, and reminding people that when you're sneezing or coughing, you should cover your mouth using a tissue or your bent arm, not use your hands. Also, cleaning and disinfecting high-touch surfaces, and if you have symptoms and you need to leave home, wearing a mask. Reminder, if you're feeling sick, stay home. Keep your kids home from school. It's really important to continue these mechanisms that we've already learned to continue to prevent respiratory illness.
All right, great. Well, thank you. So lots of content, but I get a lot of questions from you all about what if you're not counting every COVID case? What does that mean? What do we do? And so this just gives you a sense of how really at the population level we are able to track. We have a long history of doing this before COVID. We've continued tracking these other viruses. So we're going to turn now to your questions. Let me just switch modes here a second. So starting right off, Mike Chinnander from Twitter is asking, so how good of a match are this year's flu vaccines with the circulating strains? Do they help with H3N2?
Yes, they have been shown within, so with a vaccine that does that is a good match, we would expect it to be about 40 to 60% effective. From the Southern Hemisphere, we're seeing it's about 50% effective, so that's showing us that it is quite a good match.
Go ahead.
And CDC has characterized around, I think, 50 to 60 H3N2 viruses this season, again, to see how are they reacting to our current flu vaccines, and all are matching very well. So we're still early on, but again, another good sign that the vaccine is matching well to the viruses that are circulating.
Yeah, it's one of the things we watch for the most at the beginning of the season, because there are around 20 or so subtypes. You can only put maximum about 4 kind of in a year's year's flu vaccine, and so. So far, so good on this one. It means we only have to worry about the people who haven't had their flu shot, as opposed to worrying that sometimes the match is not good. Just for a piece of history on that, if you remember the big H1N1 outbreak back, oh goodness, I don't know, 15 years ago, probably at this point.
2009.
When was it?
When was that?
2009. Feels like a very long time ago. That was an example of where H1N1 had not been a strain that we'd seen a lot before. It wasn't in the vaccine for that year, and then it really emerged, got a lot of people sick, and so we had to do a second round of flu vaccines to kind of catch that H1N1. That's very unusual. We almost never do it, and so instead, we're very happy that this year, at least at this point, the flu vaccine does look like a good match. Okay, lots of good questions here. So I'm going to try to run through them quickly. Jean Brooks on Facebook is asking, how about norovirus? How much norovirus is in the schools now? I dread that more than anything.
So with norovirus,
tell people what norovirus is in case they don't know.
Norovirus is a gastrointestinal illness, and one of its prominent features is diarrhea. So within our community communications with schools, they are asked that if they need help with norovirus or any other infectious diseases, they can reach out to us because we have created some strong relationships with them, and especially because of COVID. Right now, we haven't seen an increase in the number of norovirus cases that have been reported to us from schools. In many circumstances, this may be because they're not, the diarrhea is kind of self-limiting, meaning that it goes away on its own, but right now this is not something that we've been seeing as an issue.
We've seen a lot of increased cleaning protocols too, as a result of COVID and just paying more attention to hygiene. That helps prevent and limit any norovirus. So not a big concern right at the moment. Okay, Monica has a good question here. What advice would you give people who are invited to a zillion holiday parties in the next few weeks? So I'll let you start there.
Yes, I think continuing to remember those respiratory hygiene protocols. So number one, making sure that if you have any symptoms, that this might be one of those holiday parties that you unfortunately should sit out. Number two, if you are someone who is immunocompromised, or if you're going to be visiting with someone who is immunocompromised, ensuring that you've taken a COVID test prior to the visit. And then number three, if you're going to somewhere that's very crowded, masking is a really good strategy to continue to fight the spread. And then of course, this is a great time right now to get vaccinated for both COVID and for flu prior to the actual holiday season. It does take about 2 weeks sometimes to build that immunity. So if you could get vaccinated right now, this could be great in time of the Christmas holidays.
Yeah, there are a zillion holiday parties right now because people, in the same way that the viruses are making up for lost time a little bit, they haven't had the chance to spread as much for a couple of years. We're seeing a lot of that. You know, people are also, I think rightfully, excited to be at a point where we have the tools that we can be having those parties again. But really, the first one for me is the right way you said at the top. Stay home if you're sick. You know, the masks help if you are having any symptoms, you're not sure what it is. sit it out, or at a minimum, think about wearing a mask. And then the last thing, air circulation also helps. So here in Chicago, can't really be doing it outside that much, but if you are somewhere warmer, you're able to be outside, that really limits risk. And otherwise, even cracking windows, having a little more air circulation, if you do have air filters, those kinds of things, that's another way to really limit that risk. Okay, so Francie Swidler on Facebook. As a pediatrician, have you ever seen a year like this before? So many parents are beyond frustrated by the parade of illnesses affecting their children and their households right now. Do you have any advice for them as they try to navigate this relentless, difficult season? Who would like to start on that one?
I can start. I'm not a pediatrician, though.
Yeah, that's okay.
Dr. Harwady. But yeah, I think this is a very unusual season, just that we're seeing a lot of things thrown at kids all at once, and it is kind of like back to back to back, and so it feels relentless for parents. So I think, as Michelle said, like following these sort of all of these basic kind of respiratory hygiene things when you can, washing hands, covering sneezes, keeping kids home when they're sick so they don't pass it on to their schoolmates or playgroup mates. And the other thing is keeping your kids up to date with their vaccines. So making sure they went in for the flu shot, they're up to date with COVID. These are all things that can help. But also just, it is a rough time for parents, and just kind of getting through it as best you can right now.
Yeah, and I would add sort of on the pediatrician side. So have I seen a year exactly like this? No, but every year is slightly different from the other ones. What is striking to me about this one is that flu is here and it is early. And that, I think there are a lot of parents who, I know there are parents, because they tell me, who are sort of tired of COVID and tired of mitigations, and we want our kids to be doing, all of the fun things that come with the season. But please make sure your kids, everybody over the age of 6 months, gets their flu vaccines, because flu, like for me, pediatricians are busy in this city right now and all across the country. They're very busy with respiratory viruses. The huge majority of the time, it is supportive care, right? This is one of the things I think that can feel frustrating sometimes to parents, that it's time and it's fluids and it's, keeping the kids home, and it just takes some time for these viruses to pass. But the thing that really, really hurts me kind of as a pediatrician and in this role is when we see kids get hospitalized and when we see kids die from vaccine preventable diseases, and we do see it. I almost certainly, we will have at least one child in Chicago die of influenza this year, because we see it pretty much every year. There already have been kids in the US who have died from influenza, and knowing that this is largely a vaccine preventable disease, I do worry about, families that have not yet made that choice, to come up to date with the vaccine. So we say that a lot, but, if I'm seeing patients on an individual level, I'm really having that conversation about this is looking to be a pretty early and bad year from flu. COVID is not gone, and we can't vaccinate against everything, but for the things that we can vaccinate against, it's critical to do that so that we keep kids from getting really seriously ill. And then know that your kids are building this immunity, right? Like as they get exposed, it is part of RSV. Everybody, 100% of Americans have seen RSV by the time they're 3. And if your kid just sort of had it for the first time because maybe they didn't have it during COVID, it is something that we don't have a vaccine for, and it's part of kind of building a robust immune system. And being an existing human being on the planet is building up some immunity to these viruses. But I know it's a rough time. This too shall pass. RSV is already on the way back down right now. All right, let's take Kristen Korkowski on Facebook says, I don't ever get the seasonal flu. Is it still important to get a flu shot? I've never had a need to get the shot. I've gotten all the COVID vaccines. Will the COVID shot help me have less severe symptoms of COVID as well as being double boosted? Do you want to start with that, Michelle?
Sure. So both the flu vaccine and the COVID vaccine can help to reduce the symptoms that you would get from those respective diseases. They can also reduce the likelihood that you will actually get those diseases, and then they will also reduce the likelihood that you will have severe outcomes such as hospitalization, such as ICU visits, and death. So it is strongly recommended to get the flu vaccine and the COVID vaccine, especially this year.
And to the question, will the flu shot help you have less severe symptoms of COVID? No. There's no relationship between those. So the flu shot protects against flu. The COVID shot helps protect against COVID. And to the question of, should you still get the flu shot? You've never had a need, et cetera. I would really ask you and all Chicagoans to get your flu shot, even if you're somebody, I don't know who you are, but if you are probably, I'm guessing, relatively young, relatively healthy, you don't feel like you've had as much of a need for it. You getting the flu shot, though, does protect against flu, and every person that gets it, you're also helping to protect other Chicagoans, right? Like this, when more people get vaccinated, it doesn't, flu has less opportunity to get a foothold, to really take hold, to spread. And so, first and foremost, people get vaccines to protect themselves, but you are absolutely, when you get that flu shot, you are also helping to protect your fellow Chicagoans, especially the little ones, the older Chicagoans, and those with underlying conditions. And it also helps just stop spread in general, which can help, protect against strains and variants. And that links into, this is an interesting question. Catherine Zuryabita from Facebook. Never gotten this one before. Does every variant start with just one person and then spread around the world?
Oh, that's an interesting question. I think a little bit of both. So we have seen situations where if someone is very immunocompromised and they're unable to kind of fight off COVID, the virus, they can be infected for an extended period of time. And while that virus is in their body, it's replicating, but it also can be mutating. And so we can see some of these variants can start with one person who's sort of chronically infected. The virus is mutating, and then they spread that to someone else. So that is one way that variants can arise.
Yeah, and I would say, where do variants come from anyway? They come when the virus copies itself. It copies itself when it spreads, and when it copies itself, it makes changes sort of in its genetic material. And if those changes in the genetic material result in a stronger COVID, a COVID that is more contagious, a COVID that makes people sicker, whatever it is, that will then be the new variant that is more likely to spread. So yes, at the most basic level, a variant starts, often we'll see it start in someone who may have other reasons for it to kind of spread and sort of be in their body for a long time. But it starts from a replication, from a particular copy. So in a basic way, sort of with just one person, and then has the potential to spread. But this is how all evolution really works. Whatever the more competent version of the organism is the one that will spread and will outcompete. And so the reason everything is Omicron now is because the Omicron variant outcompeted the Delta, outcompeted the Beta, outcompeted the Alpha. And that's the other reason why I'm worried where folks haven't had their boosters here. Yes, I'm worried about them on an individual level, but also it doesn't give us as much protection against potential variant emergence too. So, okay, and Alyssa Mendez on Facebook says, what's so special about COVID right now that people who are triple or even quadruple vaxxed might still be getting sick?
Yeah, sure. I think so. Our COVID vaccines are not perfect. No vaccine is 100% perfect. And what we've seen with COVID is it's a tricky virus. And although we still are seeing these Omicron subvariants, the virus still is changing a little bit, and it can be evading our immunity. So we are still seeing people that are, fully vaccinated or maybe double boosted, can become infected with COVID-19. Fortunately, we are still seeing that the vaccines provide really good protection against these severe outcomes, like hospitalization and death from COVID. And ultimately, that's what we really want to protect against. Yes, we are still seeing people become infected with COVID, but we still see a strong kind of protection against severe outcomes with the vaccines.
Yeah, and I would just add, we've talked about this in the past. There are different parts of your immune system. There's the part that fights off like right away after a germ gets into your body. If it gets into your nose, for example, there's this immediate response that ideally you're identifying it and never actually letting it infect your cells any further. But when the virus is moving very, very fast, like these very contagious versions of Omicron are, sometimes it can sort of get past that first line of defense and you can actually become infected. But you have a second line of defense, this innate immune system that also gets trained up when you get vaccines or if you've recovered from COVID in the past, but especially if you get the updated vaccine and it's a good protection against Omicron, that's the one that sort of comes in second. And that's the one that can kind of stop that infection from getting into your lungs, from getting into the rest of your body, from getting you sort of seriously ill. So that's oversimplifying a little bit, but I would say that COVID is not unusual in terms of being able to see multiple people getting infected multiple times. If you look at RSV, people get RSV multiple times sort of over their lifetime. It tends to be the first time that is the most dangerous when the kids are the youngest and their airways are really small. But you get RSV as an adult, there's a good chance you are getting it every few years. It just presents like a common cold in those who are older. And I think so it's not that COVID is so special, it's that it has continued to mutate and it did an incredibly good job of making people so sick and of killing people, right? Almost 8,000 Chicagoans died from COVID-19 already. And so we use the tools to stay up to date, mostly to protect against those severe illnesses. The vaccines do also help decrease the risk of infection, to be clear on that. We've showed that data before, but they're not 100% and no vaccine is. I wish COVID were like the measles, where if you've had your measles vaccine, you essentially won't get the measles. You're about 97% protected. But in fact, COVID is more like the flu, where it continues to mutate every year. We make a vaccine that fights off as best we can the strains or the variants that are the most predominant, and importantly, give you that protection to keep you from getting seriously ill. So that's what I would say. But what I worry about is people say, oh, I don't think the vaccine is working, because there are people who are still getting infected. Thank goodness the vaccine is working beautifully. Like, I never want to go back to what the first year of COVID looked like before we had a vaccine, right? 50 Chicagoans dying a day from COVID. Like, we are now at a point, less than one. Like, right now we're averaging 0 Chicagoans dying right now every day from COVID. And the difference between those is our immunity that we've gained largely from vaccines. But I saw this interesting campaign in the UK right now that they compared sort of your COVID vaccine to kind of like a battery, that, your protection can, like a battery can kind of go down over time. You start at 100% protection, your battery's full, and then over time you can kind of lose some of that protection. And you do want to recharge. You want to get that immune system back up. You want to get that full protection. And so that does mean getting the booster. I also think similar to flu, there's a question here, someone's asking, do you think COVID vaccines will become annual like flu vaccines? I think there's a good chance they will. I don't think, barring additional new variants, or you never want to say for sure with COVID because it's continued to surprise us, but I don't think we're going to say in the spring, get another booster, in 3 months, get another booster. No, the fall 2022 vaccine is the first time we updated the vaccine, like we do for flu, to protect against the variants that are out there right now. My guess, we'll see, is that we may do that same thing next fall. It is absolutely predictable. We predicted that we would see this increase in the winter because that is our respiratory virus season. And as you heard, COVID-19 is another respiratory virus. And so we expect it to more or less follow those patterns. All right. Mary Rodriguez from Facebook. I got the bivalent COVID booster and flu shot in September. Very good. While I know I have good protection from serious illness and I'm unlikely to need hospitalization if I get sick, how long does my immune system stay extra protective? Would it be necessary to return to vigilant mask wearing? What do you think?
I think we have to consider the other aspects of what's going on in the community. So as you know, our community level for COVID has been fairly stable. However, with the flu cases that are increasing, it is a good idea to wear a mask in any public space where you don't know the vaccine status of others. Because as we've mentioned for the flu vaccine, getting that vaccine is going to not only protect yourself, but it is also going to protect others. And so whenever we think of reducing risk of respiratory virus spread, we think about layers. So masking is a great layer if you're going to be in a crowded place, if you're going to the grocery store, riding public transportation, not only to protect yourself against COVID, but also against flu. And again, you know, even if you do have the vaccine for flu, you still have that potential to be exposed to other respiratory viruses that are not COVID or flu.
Yeah.
So this is a good round strategy.
Yeah, and I like the way Mary asked this. Would it be necessary to return to vigilant mask wearing, which suggests, you know, you're putting on masks sort of at times where it's needed. In terms of time frame, you know, we have a lot of experience with flu. September is a beautiful time to have gotten your flu vaccine. We expect that to carry you through the flu season. It's not like we would expect to sort of need another one. In fact, I'm glad you got it early, given that our flu season has been very early this year. So I would expect that flu protection to sort of carry you kind of through the winter. The COVID bivalent booster, of course, we are assessing this in real time. We don't have all of the years of the flu vaccine experience that we do with COVID vaccine. But I would broadly expect that COVID booster also, you know, the reason we did that timing is the hope is that it will also carry you through the winter. In that case, it's more about, do we see a new variant emerge or not? Right now, you've gotten the best protection against Omicron. So, you know, which again, both the COVID and the flu are pretty good matches right now. So I think, you know, you're in pretty good shape if you're up to date with your vaccines. As Michelle says, I'm never going to advise someone not to put a mask on if they're in a setting that they're worried about, but especially if you're feeling ill, okay? Like I had a cold, I caught a little bit of a respiratory virus myself over Thanksgiving. It wasn't COVID, I was testing myself. I saw all my very cute but very germy nieces and nephews. And so I was really careful. You know, A, I was COVID testing, B, I was being very vigilant about wearing a mask. C, I actually worked from home for a day. That's why we didn't do Facebook last week. Because I don't want to spread those germs. And I think if all of us can sort of think not as masking as like something that the government must tell you to do at this time, but more like an extra tool that you can use to help protect yourself or to help protect others. I would advise putting a mask on, you know, while we're in high respiratory season, if you're in these crowded settings, you know, if you're on the L and it's busy, if you're, you know, in a store, et cetera. But I think the vigilant mask wearing, the way you asked that, you know, vigilant mask wearing, if we get to a point where we're at a high COVID level, or, you know, frankly, we're going to be following along with flu here. If flu really we start seeing hospitalizations going up, we start seeing that get up to a really high level, you know, we may make some more broad recommendations for general population, kind of for indoor mask wearing. Not requirements right at this point, but some more recommendations. But at an individual level, you know, I keep mine in my pockets all the time, and I am putting them on and off really throughout the day. So good question. All right, we're almost at time. We're going to take just the last few ones, maybe. Faith State on Facebook has an interesting question. For people who are unable to swallow pills, would non-pill or real small pill versions of medications be developed for those people to take if diagnosed with COVID? I can take that one unless either of you want to. So, Paxlovid and the oral medications, that's not the only treatment available, but behind the scenes, because the reason I'm taking this, it's a little bit of a larger question. There continue to be some IV treatments that are available for people if you have underlying conditions or there's significant concern. But without a lot of fanfare, we actually have lost some of those IV treatments because of the continued variants that have been emerging. So some of you might remember hearing about getting monoclonal antibodies, right? That's basically an IV version of what if you didn't get a vaccine, for example, and people were getting COVID or they were at high risk. It's a way to kind of replicate what the vaccine is teaching your body to do. But there have been enough mutations in the virus that just in the last couple of weeks, formally across the whole country, they have pulled some of those medications because they are just not effective against this version of COVID, what we're seeing right now. So, to your specific question, if you are diagnosed with COVID, you're unable to swallow pills, you should absolutely talk to your doctor, because sometimes pills can be crushed, sometimes they can become liquid, sometimes you work with pharmacists, and that really depends on what other medications you're taking. There are also some IV medications for certain settings, but I'm using the opportunity of your question just to kind of make the point that as the virus continues to mutate, it's not just about are we seeing infections and keeping people out of the hospital. It's about are our vaccines keeping up and are our treatments keeping up. Right. So, right, like it's not good news to have lost treatments that historically have saved quite a lot of lives. Thankfully, Paxlovid remains very good at this point against this version of COVID. But there's a lot of behind the scenes work on the science side to try to not just catch up, but stay ahead of the way that COVID continues to mutate. We have lots of experience doing this with flu. If you know oseltamivir or Tamiflu, that's a medication that if you have serious underlying conditions and you get diagnosed with flu, right at the beginning, your doctor can prescribe that for you, and it significantly cuts the likelihood of sort of how sick you're going to get. We have that same idea now for COVID. So I think it's good to think of these together. It's just that COVID has been so much more deadly than flu, so it's not exactly a one-to-one. But I would say, Faye, if you can't swallow meds and you do get COVID, give your doctor a call, and they would take it from there. And then maybe our last question, Alexandria Deanne from Facebook. What can I do for a sore throat right now if I'm not sure exactly what is causing it with so many different viruses going around? One of you want to start on that?
Yeah, I think it's really important that if you have a sore throat, and especially if it's persistent, that you go to your doctor or your healthcare provider in order to get a diagnosis. In addition to the respiratory viruses, there are other infections going around as well. And being able to diagnose can potentially get you to the right treatment, as we just discussed. And then also, as you've mentioned, or as we've discussed before, staying home if you are sick, so trying to stay away from any social situations and limiting your time out of the house to going to visit your healthcare provider.
And I would just add, sore throat can mark the beginning of, for many people, it can mark the beginning of a respiratory illness, of a cold, of other symptoms. Take a COVID test. I think you said that, but take a COVID test, because that can definitely be the presenting symptom for some folks. Assuming you're COVID negative, in terms of symptoms, there are lots of over-the-counter things, but honestly, tea with honey in the studies, just as good as a lot of those other medications, especially for the sore throat. I also encourage people, assuming you don't have any other contraindications, to take some ibuprofen or to take some Tylenol. Even if it's a sore throat, it helps decrease some of the pain, decrease some of the inflammation, and try to get a lot of rest and drink a lot of fluids. So I know it can feel frustrating when it's this supportive care, but no matter what is causing your sore throat, you want to do everything you can to try to keep it from turning into something more serious, and that means getting back to some of the basics, just like your mother probably told you when you were younger, and then doing what you can to not spread that. But in getting a lot of fluids, getting a lot of sleep, and sort of treating some of those symptoms are what I would generally suggest. All right, Lee Loves I'm going to take this one real quick. Lee Loves Champagne on Twitter says, "Can Dr. Harwady run for mayor?" No. I will guarantee that, A, it is past the timeline to turn in the petitions for running for mayor, but B, I guarantee to you, I cannot imagine doing that job, and I am very happy. There's enough to worry about, just focused on the health of things. So thanks for the idea, Lee, but no. Okay, so again, I want to just thank, this is Stephanie Gretsch, our senior epidemiologist for vaccine preventable diseases. She and her team does all the behind the scenes work for so much of the data that I'm showing you every week. Again, you can go to chicago.gov or chi.gov/flu to get to all that information. And there's lots to explore if you're interested in the data. And then Dr. Michelle Funk, our medical director for youth settings, who has been incredibly busy over these last couple years, of course, but who is the one helping all of our youth settings really get through when they are seeing outbreaks and doing some of the things that we've been talking about at a more systemic level. Anything else that you would like to say, just kind of in closing, or anything we didn't get to? No?
No, I feel like we covered it.
All right, very good. Well, we will be back regular time next Tuesday at 11 a.m. And then the week after that, December 20, we'll be back at our regular time. And we are going to have a focus actually on schools. So our guest will be CPS CEO Pedro Martinez. And we'll be talking in quite a lot of detail heading into the winter holidays there about how are we doing, with COVID and CPS. They've continued to do absolutely amazing work with really handing out a lot of tests, making sure materials are available. They've done a lot with ventilation. I'm really pleased with how CPS has been doing on the COVID front. So we're going to talk about that heading into winter break, as well as a little bit more broadly some of the other health things that the Chicago Department of Public Health and Chicago Public Schools work on together. And Dr. Funk is part of a lot of those conversations. So thank you again for tuning in, for all of your really excellent questions. If we didn't get to you, we'll try to get it next week. But in the meantime, spread the news, have everybody get their flu vaccine now. Have everybody get their fall 2022 COVID booster. Keep washing your hands and stay safe. We'll see you back next week.